regulatory adjustment, and that deals with Medicare. Now, after the public option, I would say that the issue that has gotten the most attention in healthcare reform is Medicare. And as we know, Medicare is primarily aimed at older Americans, those over the age of 65. And Medicare is an essential and key component of health coverage in our country. Now, Medicare enhancement and Medicare reform is not as much about expanding the base of coverage for Medicare as it is about trying to find some financial savings and trying to revisit some reforms that have been adopted over the past 10 to 20 years. And this includes revisiting the Medicare Part D, the prescription drug coverage aspect. It also involves revisiting the Medicare Advantage program, which gave greater access to the Medicare program to private insurers. Now, this is the 2009 Congress and President looking at reforming decisions that were made years ago, oftentimes in a Republican-dominated era. But I always tell people this: who makes the law in this country? The President or Congress?
The laws.
All right, well, hold up on that. I'm a constitutionalist. Congress. And Congress is made up of members of what? Both parties? Yes. Okay? So reform is usually both parties. And you know what? This year's reform might be next decade's problem to be reformed again. And that's what Medicare reform is in large part with health care discussion today. The third aspect is actually, and this gets a little bit more complex, it's about reforming the individual and small group insurance market in the United States. And in many ways, what's being discussed today is aimed at correcting some of the deficiencies, some of the shortfalls, some of the unintended consequences, and frankly, some of the changes that have happened since 1996 when the Health Insurance Portability and Accountability Act was passed. Most of us know that as HIPAA. Okay? The HIPAA bill was passed essentially to try to ensure portability of insurance policies when you move from one job to another. It was also aimed at tightening up some of the underwriting practices in the small group and individual insurance market. HIPAA did a bit, but many people say that HIPAA did not go far enough. And regardless, it's been, if my math is correct, 13 years since 1996. The world has changed. And so a lot of the healthcare reform that we are looking at deals with reforms in the individual and small group insurance market, dealing with how you underwrite a policy for an individual who's not in, say, an employer-based system.